Our Culture Competency Group project is on Haitian heritage.
Hey everyone, we're the Asian Heritage Culture Group. Content outline is listed as follows. We have the introduction part of our project, and Genesis is going to speak about life, death, and religion. Matthew is going to speak about sociocultural norms and family roles. Adelaide will speak about politics and political events associated. Tanaz will speak about the socioeconomic part of the Asian culture. And Eder is going to speak about the Ed belief, risks, and stigmas associated. And last but not least, individual is going to reflect and also speak about the vision for the future. And also, we list where we find our resources and what we use to, where we gathered all our information.
As we learn more about the Haitian people and their culture, it is important to give a quick background to better understand the information later to come. The Haitian people are descendants of the then enslaved Africans and Taino natives, along with some French and Spanish colonizers that lived there. After gaining independence in 1804 in the battle against the Napoleonic Army, Haiti was governed by a semi presidential republic, which meant that Haiti would be governed by a president, a prime minister, and a cabinet. Unlike a democratic government, the president would have no hand in the legislature. Haitians are typically known to practice Christian voodooism, with Catholicism being their official religion since 1697. Haiti's majority would speak Haitian Creole, which is French based, alongside with other languages not as commonly used, including French, Spanish, and some English, which depended on the individual's education and social class. While Creole is a spoken language, it is not widely accepted as a written language due to many of their texts being in French from the colonization.
My name is Genesis Soto, and I'll be talking about the objectives for this project. The purpose of our project is to explore the role of culture on the health and wellness of the Haitian community. This is to help us contrast cultural views of wellness, health promotion, illness, disease management, and dying. The objective of this presentation is about understanding where other people come from and how their health is influenced by their lifestyles, but also about how we treat them based on our own ideologies and biases.
Three relevant healthcare disorders. The three relevant healthcare disorders are mentioned are human immunodeficiency virus, or HIV, chronic health conditions, and maternal and neonatal mortality. With HIV, according to Puttkamer and colleagues in 2023, Haiti has the largest percentage of PLHIV in the Caribbean region, an adult percentage of 2.0%. A respectful and welcoming approach, privacy protection, proper support, and resources could help with patient care and satisfaction. Puttkamer et al. 2023. Chronic health conditions. As mentioned previously, Haitian culture has a chronic health condition such as diabetes, hypertension, and cancer, according to Allen et al. In 2013. Conditions believed to happen because of the stress and poverty levels, according to Allen et al. In 2013. Providing better resources could help provide a better environment and help decrease stress levels within the Haitian population. Allen et al. 2013. Maternal and neonatal mortality. One of the world's highest maternal mortality rates, according to Alex and Whitty Rogers in 2017, and one of the world's highest neonatal mortality rates, according to Alex and Whitty Rogers in 2017. Some limitations included transportation and lack of basic material resources, according to Alex and Whitty Rogers in 2017.
Birth, death, and religion. Haiti has the highest maternal mortality in the Western Hemisphere. About 1 in 80 women die of childbirth related causes. In rural Haiti, matroons are used as birth attendants. 70% of women in rural Haiti give birth at home. A matron is someone in the community women rely on to help during childbirth, but this person is not trained. There is a severe shortage of healthcare professionals, including midwives and birth attendants. Haitians do not see pregnancy as an illness. Therefore, pregnant women do not seek prenatal care. Pregnant women tend to eat large portions and favor red foods, as they believe this can increase baby's blood. Mothers do not stay in bed after giving birth, which usually happens at home. This contributes to the mother and newborn high mortality rate. Birth control is considered inappropriate, and abortion is considered a taboo. Funerals are social events that last several days and include consumption of foods and rum. Family and friends get together. Men play dominoes and women cook. Pre happens within the week of death and sometimes several years later. People socialize for 9 days and perform rituals. Due to cost, people prefer to be buried above ground in a coffin, which is an elaborate multi-chamber tomb. Life expectancy in Haiti for males is about 61 years and a half, and females about 65 years and a half. The leading cause of deaths in Haiti are stroke being number one, it's about 12% of population. Then we have low respiratory infections, HIV and AIDS, ischemic heart diseases, diarrheal diseases, diabetes, interpersonal violence, preterm birth complications, tuberculosis, and at number 10 we have birth, asphyxia, and trauma. Haiti's official religion is Catholicism, and Haiti's popular religion is serving the Iowa, also known as voodoo. It is stereotyped as black magic. Voodoo is a mix of African and Catholic beliefs and rituals. Haitians believe in self-treating entities before getting professional help. This means that home remedies are used first. Voodoo is used as a healthcare system to promote health and prevent diseases. Illnesses are also seen as supernatural causes. Voodoo uses home remedies like plants and rituals to heal. Most Haitians believe in the existence of a greater power, and that greater power decides the fate of everyone. To receive blessings from this being, they often offer sacrifices, perform rituals, and gather in festivals. About 80% of the population in Haiti are Roman Catholic, and this includes the Catholic Voodoo syncretism. About 16% of the population are Protestant Christians, about 1% atheism.
As stated before, the Haitian people normally speak Creole, while many of the educated individuals also speak French. Informal greetings are typically hugs and kisses, which represent affection, unless between a man and a woman, which is replaced with a handshake, typically used in a very formal and composed manner. While hugging and light kissing is the universal form of warm greetings between friends and family, public affection tends to be more of a taboo. It has been noted on numerous resources that Haitians tend to be very patient and friendly due to their reserved nature and hospitality. However, Haitians tend to mistrust interpreters given their need for privacy. Instead, a family member, not a friend, might be requested, but without a family member, they would prefer a professional who they will not see again. Gender roles hold a traditional value. Women typically have domestic labor roles such as cooking, cleaning, and taking care of the children, while men work outside of the house farming or other laboring jobs. Such instances would also be noted in the public if it is common for male nurses to be questioned, for they typically believe that men should be physicians and women should be the nurse, but still offering respect and trust. Sexual taboos include homosexuality, birth control, medical abortions, circumcisions, and females practicing premarital sex, as well as alternative gender identities. While abortion and birth control are typically looked down on, it is allowed for a woman to drink herbal teas to induce an abortion. It should be noted that there's a strong debate on if this culture relies on a patriarchy or a matriarchy, but when speaking in matters of sex, young men are told to have sex to affirm their gender as men, while young women are told that they are to keep their virginity due to the unneeded sexual gratification as compared to men.
I will be talking about politics and political events in Haiti. Haiti has been plagued by a series of political events and crises that have made worse its existing challenges. The country has faced civil unrest, political instability, violence by gangs, kidnapping linked to state actors, and human rights problems. In 2018, the government decision to eliminate fuel subsidies sparked widespread civil unrest. Demonstrations intensified in 2019 due to evidence of corruption and embezzlement of funds meant for infrastructure and healthcare. In July 2021, a Haitian president was assassinated. His name is President Moises. Further deepening the political crisis, he appointed Ariel Henry as the prime minister before his death, which has who assumed leadership after he passed, but his installment was deemed unconstitutional by some civil society organization, and efforts were made to transition the government and plan general election for 2022, which never happened. The investigation into Moses' assassination faced so many obstacles, including threats against judges involved. The Haitian National Police arrested several individuals, including former Colombian military officers, but concerns were raised about the treatment and lack of access to legal assistance. To continue, violence and displacement in Haiti have increased. Many Haitians have moved to the neighboring country, which is the Dominican Republic, in search for better life and healthcare and means to fulfill their economic needs. With numerous gangs vying for control over territories, massacres and human rights violations by these gangs and security forces have gone largely unpunished. Human rights defenders, including judges, activists, and journalists, have faced attack, threat, and intimidation. The criminal injustice system remains overwhelmed with severe overcrowding in prison and limited access to fair trial. Haiti struggles to meet the basic needs of its people, including health, water, food, and education. The population faces poverty, food insecurity, and inadequate access to clean water and sanitation. The 2021 earthquake further made worse these challenges, causing extensive damage to infrastructure and displacing thousands of people. Discrimination against marginalized people such as women, LGBTQ individuals, people with disabilities, and migrants persists. Gender-based violence is prevalent, and the rights of this group are often violated. The international community has been involved in addressing some of IT issues. However, foreign investment in the mining sector have faced resistance from communities concerned about environmental degradation and displacement. Overall, in conclusion, IT political and humanitarian situation remains highly complex and requires sustained effort to address its deep-rooted challenges.
some of the structural vulnerabilities of the Haitian community and culture include just scarce access to healthcare in general. This comes in the form that, Haiti is constantly battered by natural disasters such as earthquakes and hurricanes, and also a lot of political uprisings that directly affect the socioeconomics of the country. And this in turn affects the people. So diving a little more into that, there are some socioeconomic norms that increase the risk for negative health outcomes, and some of these are scarce access to health care, disproportion of commissions, or maldistribution of wealth, resulting in inequality between who gets what. And once again, this goes back a lot to the politics of the country, and when there are natural disasters and families need help, there are a lot of times where if you are one of those people who is giving things away that other countries have donated or from your reserves, you will give them to your immediate family or friends or people who have served you in a way. This has been heavily documented in Haiti and also in Little Haiti, which is in Florida and considered one of the largest populations of Haitians outside of Haiti. Another example is the constant battery from natural disasters such as earthquakes and hurricanes. This is at no fault of Haiti, but just because of their location geographically, they are very prone to earthquakes and hurricanes. So even when they come to create some of those social determinants like economic stability and just education access and quality, healthcare access and quality. Anytime it seems like they start to get to a good place with the aids they're getting or just picking back up on their feet, there's another hurricane, there's another earthquake. And this is detrimental because building great education sites are expensive, and also building good hospitals and community hospitals or large-scale hospitals are extremely expensive and require a lot of resources. So when your resources are constantly being battered and destroyed by just the earth, that's really devastating. And so another effect can be education. So in the U.S., Haitians face linguistic and economic barriers to healthcare, and large populations of Haitian immigrants flee for sociopolitical and economic stability. And these populations are at risk for language barriers compounded by low education statuses. This is like a catch-22, and as an immigrant, I can attest to this myself. It's very hard to not be a native English speaker and then coming to America where you have to speak English. So this is really hard, because if you're having a hard time learning English and at the same time you can't really dedicate as much time to your education because you have to work and help your family, that's really hard, and that kind of prevents a lot of Haitians from being able to fully reach their educational potential. Speaking a little further on the effects of education on the socioeconomic standings of Haitians, is that education is significant in Haitian culture. They actually really, really, really value education. One of the largest barriers to Haitian immigrants in the U.S. is this language barrier. And then the second largest hindrance is poverty and the difficulty of getting out of poverty, as we discussed earlier in the previous slide. Tying this back into how social determinants of health can affect this culture group, the two biggest ones are just economic stability and access, and that's access to both education and to healthcare. A lot of Haitians have a difficult time gaining economic stability because in this country, you need to be educated for the most part to have a good job, which will help give you economic stability. And a lot of Haitians do not get that luxury, and becoming educated in the U.S. is a luxury. And this goes into having access to quality education and healthcare.
Health beliefs, risk, and stigmas. Some health beliefs in Haitian culture, according to Allen and colleagues in 2013, include traditional or religious leaders and family members playing a significant role in healthcare and are usually preferred over Western medicine. That is because God is first in Haitian culture, and physical health usually reflects spiritual culture. Another belief in Haitian culture, according to Allen and colleagues in 2013, once someone knows about a diagnosis, it usually indicates that death will result much quicker than if they did not know about that diagnosis at all. According to Allen and colleagues in 2013, learning about a diagnosis is not considered useful because there is no prevention for diseases, only late interventions. Some of the risks associated with Haitian culture, according to Allen and colleagues in 2013, include chronic health conditions such as cancer, diabetes, and hypertension, mental health concerns that are amplified by poverty and stress, limited knowledge about proper healthcare screenings, barriers that include language or communication, beliefs about medication administration and the effects of having to take a medication every day, implicating that that would actually be harmful to their health, and healthcare costs that lead to mistrust within healthcare workers because it is believed that healthcare workers have hidden motives due to healthcare costs. According to Allen and colleagues in 2013, HIV and tuberculosis are common diseases that are stigmatized within the Haitian culture. A stigma that I found within the Haitian culture that was discussed frequently was mental health. According to Jesus in 2016, shame is attached to mental health conditions because of the decreased level of functioning in daily life activities. According to Jesus in 2016, mental health conditions have two different views within Haitian culture that include a supernatural occurrence or a natural problem. To receive help through supernatural occurrences, the way to seek help is through voodoo gods, and if it is a natural problem, the way to seek help is by praying to God.
So by this point, we all know what cultural competency is. Now, some examples of how healthcare professionals can utilize structural competency to improve healthcare outcomes within the Haitian community include being aware of some of their very specific cultural views and opinions. One is that many Haitians expect healthcare workers to have a wealth of knowledge. So when a healthcare professional asks too many questions, it comes across as if they're incompetent providers. We as healthcare professionals can explain that, we are competent, we have a wealth of knowledge, but we are asking questions just so that we can further understand and get a good and deep clinical picture of the patient holistically. And also to just be honest and say, tell me more about what the Haitian diet includes. How do you prepare your foods? Is it a lot of baking? Is it a lot of grilling? Is it a lot of frying? If so, what kind of oils are you using? These are just questions that can, like a primary care physician or provider can ask to really further understand just their dietary ways of living. Another one is to encourage annual physicals. Most Haitians in the U.S. do not seek medical care unless there is an illness. We can help by just educating them on the importance of prevention to help reduce illness. So as I discussed earlier in my slide, it's so much easier to prevent hypertension, high cholesterol, and reducing the risk of heart disease and stroke than to have to treat these illnesses. And these illnesses end up leading to a plethora of other illnesses that can last a very long time and have detrimental effects on the body. In general, I think we can all practice cultural competency by valuing diversity and having the capacity for cultural self-assessment, just being conscious of the dynamics within cultures and just how different cultures interact, and also just developing adaptations to service delivery and reflecting an understanding of cultural diversity. And, one of my biggest things that I do as a nurse is I explain to my patients and their families, hey, I'm not aware and I just have not met a lot of people from your specific background, and I would love to learn more, and I would love to know how I can better serve your loved one and you. So, in the Haitian culture, it is commonly believed that illness is due to an imbalance with nature. This can be caused by cold winds, natural impurities in the food, air, or water. This is Tanaz. Hi. So, I'm Persian. which is Iranian, Central Asian, and kind of European. And, our culture, I didn't realize was so similar to the Haitian culture. So in the Persian culture, we believe in hot foods and cold foods. And we believe that mixing of the foods we deem as hot foods with cold foods cause an imbalance within our bodies, which end up causing illness and discomfort. An example is watermelons are considered cold foods. And if you eat watermelon and then turn around and eat squash or zucchini, which is considered hot foods, you are at risk of getting stomach ulcers or stomach pain and fevers. And this is just, it seems like a wives' tale, but it's what we believe in. So I would compare the Haitian and Persian cultures' values and practices are quite similar. As a healthcare professional, I would support my Haitian patients by expressing my understanding of their beliefs and traditions while also highlighting the benefits of traditional medicine. I say this because a lot of Haitians believe in herbal remedies and herbal medicines. And, one thing in the U.S. is a lot of clinicians will be one way or another. You either only have to use herbal remedies or you have to use pharmaceuticals, but really they can be used in adjunct and together. And it's a lot more helpful when you just explain to your patients, especially the Haitians who have a ton of herbal remedies they use. You can say, hey, these herbal remedies do not interact with any of your known prescribed medications. Please take them together. Maybe they'll enhance each other and truly help make you better by treating you holistically.
As part of my vision and reflection, I wanted to compare my culture to what I had learned during this presentation, as part of how we can include cultural and structural competency. In indigenous cultures, we used to celebrate our sexual and gender differences. Unlike the Haitian culture, which views these individuals as part of a taboo, we view them to be of higher value due to their closeness with nature and the Great Spirit. Instead of being a part of a sin, they are the embodiment of knowledge and higher power. Two spirits, as we call them, were typically in the tribal council as leaders, shamans, healers, and advisors. When comparing my culture, I see a few differences, including religion, beliefs on sex, such as contraceptives and reproductive surgeries. However, there are a few things that are kind of similar, such as Christian beliefs about abortions, homosexuality, alternative gender identities, etc. But much like any other culture, not everyone believes the same thing. So sometimes it's hard to determine exactly how to compare, but believing that everyone fits under one specific category is of generalization. I think that what has changed my outlook in healthcare is the dire need for services for language barriers. Before now, I honestly had not really thought a lot about different languages that others speak, and yet it's all around. That is important to not only have visual aids, but also written documents in the needed language, as well as interpreters that may be able to help the patient. I think the most important part is being open to learning, allowing yourself to learn more about people and where they come from, but not just in a generic way. This presentation is a great opportunity to start learning, but it doesn't provide individualistic characteristics. As a healthcare provider, you need to care for that person's specific needs and not just a general idea. This includes being approachable and welcoming, being open minded to new information, and allowing them to explain to you what they need in their language. Having a specific department for professional translators and interpreters available, making sure that important information and instructions are clear and can be read and understood by the patient in their native language or in images that may be more comprehensible for the individual. It is also important to make sure that services are available for individuals that have children or those that take care of older adults in lower income families.
Reflection and vision. In rural areas of Puerto Rico, it is very common to treat illnesses with herbs and home remedies before getting medical attention, and also believe that there is a power that decides all of men's fate. When it comes to religion, I would say both Haitians and Puerto Ricans share similarities. I would support my Haitian patients by listening to them, learning about their specific need, and what they do in their culture. I will incorporate that with education to help them understand any doubts or misconceptions they may have. Healthcare professionals will be able to help this community with resources and access to healthcare. Some strategies can be transportation that can transport patients to clinics, offer health promotion and wellness services, and have resources available in the language they speak, such as instructions for medications and activities, consent forms for surgeries, and other items that are written in a language that they can understand or read out loud by an interpreter.
By becoming more culturally competent about Haitian culture, understanding that asking multiple questions about their health may lead to mistrust and health screens are limited and feared due to health and intervention concerns. It can be useful to ensure proper education through interpreter services to help ensure a trusting relationship with the patient, and also ensure that education is properly received and understood to help eliminate fears. For our vision, we would find a way to make every patient feel comfortable, respected, and feel as if they have a voice, making sure not to categorize them based on how they look and speak. It's important to make sure that they have access to aids and resources. Specifically for the Haitian culture, we would make sure to destigmatize them and remove the feeling of being the accused minority, making sure they feel equal to every other patient that walks in.
Reflection and vision. As an African who has also lived in Haiti, I've noticed significant similarities between both countries. One prominent similarities is the reliance on traditional medicine as a form of treating minor ailments, and I've seen a lot of these during my time in Haiti. There are people believe more in using herbal remedies to take care of themselves when they're sick. So, as a professional, um, we could actually allow the patient to practice this as long as it doesn't have any side effect on the other medication and anything against it. So, like I said, we could call in pharmacists to go through their medication and see the other supplement they're taking, other medication that they're taking, to see how we can like work with both type of medication to get the patient to be compliant in their treatment and get a solution. So I believe like finding a way to integrate their own beliefs, their own cultural beliefs, and into their care, we actually go a long way in increasing patient compliance and lead to a better health outcome.
These next two slides are just resources that our group used for our presentation. It also includes 3 scholarly articles, such as Sexual and Family Introductions in Northern Haiti, Haiti in the Americas, and Social, Economic, Dietary, and Health Determinants of Body Composition in Haitian School Children.